Keloid scarring, a medical condition generally not perceived as sexy or as dangerous as breast cancer, yet it can affect anyone with pigmented skin, especially African Americans and young women. In fact, many of us don't even know what keloids are unless they affect us and then can take over, literally. This is John from Kampala, Uganda, whose doctor sent pictures to Dr. Michael Turgan, a medical doctor who specializes in keloid treatment and research here in New York City, looking for a treatment to help John after efforts at Uganda's Mulago Hospital produced no fruitful results, his doctor said. Among several symptoms of keloids, these scars cause painful itching and swelling in many cases and are very sensitive to the sun, raising concerns about the physical and psychological impacts imposed on people who suffer from them.
In this country today, there are more people with keloid who are living with this disease and suffering from it than with breast cancer. It's a lot more common.
Keloids are tumor-like scar tissues that grow beyond the edges of a wound or incision, often red or darker in color than the surrounding skin. Keloids can occur anywhere on the body, but they're most common over the breastbone, on the earlobes, and on the shoulders. These scars occur when the body continues to produce the tough fibrous protein known as collagen, typically after a wound has healed, but after speaking to some of Dr. Turgan's patients, they told us that they experience keloids from a mosquito bite or a pimple, like Tanisha, who's been ridiculed by peers because of the scars surrounding her ears and sideburns.
Before I had, this kid told me that I had eggs on my skin, or I get a few stuff like, it's not as much, but you know, some people, they say rude stuff, or I work in retail, and like when people stare at you, it's like they're not staring at you, they're just, you know, constantly staring at any other spot. But that's about it.
The one on my left shoulder I got since I was a little, messed with my vaccination. The one over here I got when I was 14. My sister accidentally burned me with a sparkler 4th of July. I got one on my right breast because I had to get a biopsy. It was negative.
Very little attention has been given to keloid scarring. Some research we found indicates that keloids occur in about 10% of the population. That's 10% of 7 billion people living in the world today. With little attention and research comes continued inadequate treatment. The scar tissue is typically cut out and the wound closed with 1 or more layers of stitches, which Dr. Turgan tells us results in more keloid growth because these types of scars have a stubborn tendency to recur, sometimes even larger than before. To combat this, some doctors combine scar excision with steroid injections, but still with little success. Radiation is also being used. However, multiple treatments are typically required, and it is popularly understood that radiation can cause cancer.
I've gone to Johns Hopkins, I've gone to Georgetown University, and they have been unable to treat me. At Johns Hopkins, they gave me steroid injections, and that did not help. In fact, I've had surgery, and each time they would cut it off, it would come back larger.
Dr. Turgan uses a method known as cryotherapy to treat keloids. He demonstrated what the procedure is and how it works while performing it on Jenny.
What we're going to do here, we're going to inject some lidocaine and numb the area, and then we apply liquid nitrogen to it. Initially, after freezing, the tissue swells up, forms a blister, may be uncomfortable for about a day to 2, and then oozes and leaks some fluid from it. 4 or 5 days later, starts drying out. Usually about a week to 10 days later, the tissue is completely dry.
Part of Dr. Turgan's frustration and why he's designed 7 studies and counting on the condition and has now begun reaching out to the World Health Organization, the plight to create collaborative efforts to help patients suffering from keloid scarring.
This is a condition that, in my opinion, has been neglected by the research community. We have really not done the work that we need to do on this disease. This is not a disease that we would be able to treat with surgery because most patients have recurrence of the disease after surgery. Why? We don't know. These are areas that need to be researched.
As for now, Donna, who has received 2 treatments of cryotherapy, have proven successful for her post-belly button ring keloid.
It builds your confidence, you know, when you have that removed.
And one side of Tanisha's sideburn area keloids have virtually disappeared with cryotherapy and progressing along with today's treatment.
I feel much better. I feel more confident than I was before. Because before I used to wear like hats so that way it would cover it, or if I were to go outside and the wind would blow, I wouldn't want my hair to blow back, so I'd just, you know, walk around like this so it wouldn't.
Yeah.
But this is not enough, says Dr. Turgan, for people like John in Uganda, whose keloids are far too spread out and too large to treat with cryotherapy alone. Requiring multiple cross-continent visits would loom to bankruptcy if they were possible to make at all. Dr. Turgan says that more research, collaboration, and resources need to be devoted to keloid treatment in order to help everyone.
Right, keloid is not a disease of Americans. It's an international disease. It is common across the world. I have seen it in people from every nation that you can imagine, but it is more common in Africa. What we need to get from WHO is to try to get some support to investigate this disease and also put spotlight on this disease. So we are conscious about it. We try to attract other investigators to do research in it, to hopefully learn more about the disease and what drives it, and also find ways of treating it and coming up with better treatments. That's the whole goal.
As part of our mission to help advance social development, the task at hand is to connect Dr. Turgan and others like him with the World Health Organization of the United Nations to help build partnerships that could find solutions to treat people with keloids around the world. Afaf Kanja for South South News, New York.